Hi, my name is Liberato Martinez. I am a licensed insurance broker and I am here to help you with your Medicare. And today we're going to talk about Medicare enrollment periods. So Medicare enrollment periods are super important. There are different ones at different stages in your life after you are eligible for Medicare, and they're very important because you could incur penalties. So we want to make sure that we explain them and you know exactly what to expect and when to enroll. So we are going to talk about enrollment periods for Medicare Part A, Part B, C, and D. So Part A and B is original Medicare. That's done with Social Security. Then there's Medicare Part C, also known as Medicare Advantage, as well as Medicare Part D, D for drugs, that is your prescription plan. And then we are also going to talk about Medicare supplement plans, also known as Medigap plans. So let's talk about Medicare Part A and B. That is your first step in enrolling in Medicare. So Medicare Part A and B is administered through Social Security, the Center for Medicare, and the Center for Medicare and Medicaid Services. Now you apply through Social Security. Now if you are already receiving Social Security benefits, then you're automatically going to get enrolled in Medicare A and B. You will get a card in the mail about 3 months before your birthday month and you're good to go. All you would need to do is take a look at Medicare Part C, Medicare Advantage, or Medicare Supplement to see what's the best route for you. Now, if you don't enroll in Medicare Part B, you will or could incur a 10% penalty. That's 10% for every 12 months that you don't have coverage, and that penalty is for life, so super important. Now, we're going to talk about the very first enrollment period. That is your initial enrollment period. Happy birthday, you're turning 65. That is your initial enrollment period. You need to apply for Medicare Part A, Part B. And you have a 7-month window to do that. And that is to apply for A and B. And during that window, you could still also apply for Medicare Part C, Medicare Advantage, or Medicare Part D, the prescription drug plan. So you have a 7-month window. Let's just say your birthday is in June. You have your birthday month. And then you have 3 months before your birthday. So you go back to March, April, and May. March 1st is when your enrollment period begins, and you can apply anytime during that window, March, April, and May. If you apply during that window, your plan would start on June 1st, the first day of your birthday month. And let's say you missed that. Well, you still have the month of June. Your plan would start July 1st. It always starts the first day of the following month. And then you would also have August, September, and October to apply. July, August, September, excuse me. It's July, August, September. So you have that 3-month period afterwards, and it would start the first day of the following month. So you get a 7-month window. Now, once you get your Medicare Part A and B, and you apply through Social Security, you would be eligible to apply for a Medicare Part C plan during that same window, and also or a Part D plan, your prescription drug plan. Now, we talked a little bit about that penalty. So if you're going to continue to work, that would satisfy your requirement of credible coverage to not get that penalty. So in order to not get that penalty, you have to have credible coverage. That could be your work or union plan. So if you have that, you're good. You can continue working, continue to be on that employer plan, and you will not incur that penalty. So there's nothing you need to do, and we could talk about a special enrollment period later in this video when it's time when you leave your work plan. Now, what does not count as credible coverage? Marketplace or ACA coverage, such as the Affordable Care Act, depending on your state. Retiree health plans does not count towards credible coverage, and COBRA does not count towards credible coverage, but a work plan does, or a union plan that does. So that is your initial enrollment period. Now, there's also annual enrollment. It's very well advertised. That's when you start seeing the commercials and you start getting a lot of mail. It's annual enrollment. That is from October 15th through December 7th of each year. During that time, you can go ahead and change your plans. You can enroll from one Medicare Advantage plan to another Medicare Advantage plan. You could disenroll from a Medicare Advantage plan and go back to original Medicare and apply for a Part D plan during that time. So you can make changes. During this time from October 15th through December 7th, any application taken during that window, the plan would start in January the following year. During this time from October 15th through December 7th, any application that you take during this time during annual enrollment would take effect on January 1st of the following year. So that's annual enrollment. So after annual enrollment, you also have open enrollment. Open enrollment is from January 1st through March 31st. Here, you can do a one-time change. You can go from Medicare Advantage plan to Medicare Advantage plan. You can also go from Medicare Advantage plan back to original Medicare and apply for a prescription drug plan. Now, let's just say you made a change during annual enrollment, or you missed annual enrollment and you're not happy in the plan you're in. You can still change one time from January 1st through March 31st. That is your open enrollment period. Now, also during the same time, January 1st through March 31st, you have your general election period. That is when you can apply for Part B if you missed it during your initial enrollment period. If you missed that during your initial enrollment period, you could be incurring that penalty that we talked about, but you would be able to apply January 1st through March 31st for your Part B. Now, your Part B would again start the first day of the month after you apply. So that is general election. Then you go into your lock-in period. The lock-in period is from April 1st through December 31st, and that is when you will stay with your plan, your most recent plan that you have, and you will have that plan for the rest of the year. Unless you qualify for a special election period. A special election period is some life-changing events. So let's say you moved out of your service area. Either you changed counties or changed service areas, or you moved out of state. Now that is a qualified special election period where you can change plans. Or, very common, you leave your work plan. You leave your work plan, and now that opens up a special election period so that you can apply for your Medicare Part A and B. And then there's also a chronic special needs special election period. That is if you, let's say you develop throughout the year diabetes, for example, or heart disease, that now makes you eligible to change plans to a chronic special needs plan. So that does create a special election period. Those are the most common. There's actually over 30 some different special election periods that qualifications that would make you eligible. There's a lot of them, but those are by far the most common, and you would have about a 2-month window to change plans once you meet your special election period qualifications. So now we've talked about a lot. We've talked about your initial enrollment, we talked about annual enrollment, open enrollment, and special election periods. Now we're going to talk about Medicare Supplement and those different we're going to talk about Medicare Supplement and those different enrollment periods. So you can actually apply for Medicare Supplement year-round. Now there's usually underwriting when you apply, for a Medicare Supplement. So there's medical underwriting. They're going to look at your health history, they're going to look at your prescriptions, and they can either deny you or give you an extra rate or give you the standard rate. However, what's very important is during Medicare Supplement initial enrollment period, there is no underwriting. And that initial enrollment period for Medicare Supplement starts, it's a 6-month window from your Part B effective date. So if your Part B effective date, for example, was June 1st, you have until December 31st to apply for Medicare Supplement with no underwriting. That is with guaranteed issue. Now in some states, such as California, you actually have a little bit longer by 12 months. However, the general rule is 6 months. There is no annual enrollment. However, there are things like the birthday rule, where in some states the birthday rule applies. So during your birthday month, you can change from one Medicare supplement plan to another Medicare supplement plan with no underwriting. Or if you lost coverage, that would also give you a guaranteed issued window as well. So that is Medicare supplement, also known as Medigap. And so that's a lot. So we've covered your initial enrollment, annual enrollment. We also talked about open enrollment, general election period, your lock-in period, special election, and Medicare supplement enrollment dates or enrollment periods. So it's a lot. I know. If you want more questions, please comment below. I'm happy to answer them. Give me a call. I'm glad to help you. That's what I do. My name is Liberato Martinez. Thank you so much for your time. If you have any questions, please let me know. And please don't forget to like and subscribe so you can get notifications for upcoming videos that we'll be producing to help you understand Medicare so you can make an educated decision on your health plan. Thank you so much. Have a great day.